Good morning and welcome to our Future Health webinar, which is being brought to you by COTA Queensland from Parliament House, Brisbane. As Queensland Seniors Month 2021 draws to a close, it's an opportune time to think beyond this month-long celebration and turn our thoughts to what needs to be done over the next 10 years to improve the lives of older Queenslanders, their families and their communities. COTA Queensland acknowledges the traditional custodians of the lands that we are meeting on today, and we pay our respects to elders past, present and emerging. We are conscious that many Indigenous Australians experience poorer health than other older Australians, often dying at much younger ages, and therefore improving the health of Aboriginal and Torres Strait Islander peoples must continue to be a national policy. Today's webinar, Our Future Health, aims to provide vital information on the decade of healthy ageing 2021 to 2030, and what it will mean for all of us. In February 2020, the World Health Organization, WHO, launched the Decade of Healthy Aging. WHO defined healthy aging as the process of developing and maintaining the functional ability that enables well-being in older age. Functional ability is about having the capabilities that enable all peoples to be and do what they have reason to value. It's a new way of looking at aging and should shape our future health policies, programs and outcomes. Led by WHO, the initiative will bring together governments, professionals, academia, the media and society for 10 years of collaboration to improve the lives of older people and assist rapidly aging populations around the world to live their lives with dignity and equality in a healthy environment. Today we will hear from futurist Shara Evans, who will share her insights into what the future may hold with regards to technology and health over the coming decade. We'll also hear from the Secretary General of the International Federation of Aging, Dr. Jane Barrett, who will provide an international perspective of the decade of healthy aging and what IFA are doing. And Queensland's Minister for Seniors, Disability Services and Aboriginal and Torres Strait Islander Partnerships, the Honourable Craig Crawford, will offer the Queensland Government's perspective, and I will talk about why and how COTA Queensland will be taking an active role in the decade ahead. I'm now delighted to introduce our first keynote speaker, Shara Evans. Shara is a technologist, futurist and professional keynote speaker. She is recognised as one of the world's top futurists, fusing her engineering background with an intuitive understanding of how society is likely to respond to new technologies. Shara is also the founder and CEO of Market Clarity, an award-winning technology analyst firm, and a regular media commentator on technology issues, appearing on shows such as Sky News, ABC's Q&A, The Project, Weekend Sunrise, The Drum, Landline, 7:30 and more. More recently, Shara was featured commentator on Fox and CW Network's Life 2.0 science documentary series in the US, which was nominated for 3 Emmys in July 2021 and in March 2020 named by Forbes as one of the world's top 50 female futurists, one of the few technology futurists featured in the Forbes list. Please join me now in giving Shara a warm welcome.
Thank you very much, Mark, and hello, everyone. I just need to be able to share my screen, and we're going to get going in a moment. It is my absolute delight to be part of COTA's program today. As Mark said, I'm a technology futurist, and I love talking about advanced healthcare. And when it comes to healthy aging and the things that will be in store for us, the sky is the limit with new technologies that are on the horizon. In the time that I have available with you today, I'd like to share some insights on some cutting-edge technologies that you may not have heard of, but that are going to impact many of your lives in either the near term, midterm, or longer term future. So let's have a little bit of fun while we're doing this. If you wouldn't mind, share in the chat screen your feelings and reactions to the things that I'm going to talk about. One of the very first technologies that excites me about where we're going in terms of healthy aging is the promise of smart contacts. How many of you have heard of smart contacts? Well, they are at some stage going to combine everything that you find on a smartphone, augmented reality, and biotech applications, all in a single device that sits inside your eyes that you can pop in and out. Now, this is a technology that I've been tracking since the late 2010s, and it has had stops and starts. There are all kinds of companies that are involved in this, ICT companies, pharma companies, augmented reality companies, you name it. And it just keeps moving out and out and out in terms of when it's going to be available. But what I've seen in the last year and a half is that we're finally starting to make some progress with some solutions that look like they're going to be near-term beneficial to many people. So let's start with a bit of the ICT side of things. And here I'm talking about having in our eyes the ability to have augmented reality without wearing glasses. And one of the companies that has recently come out of stealth mode, as an example, is a company called Mojo Vision. And they have a contact lens that actually looks like a blue eyeball. And it's still in prototype form, but they've attracted over $100 million US of venture capital and have recently been taken up by Disney in their accelerator program. And if you can imagine that you've got these contacts in, and as you're looking around, you're getting enhanced information on the things that you're seeing. So let's say you and I are passing each other in the street. I might see an overlay of who you are and some background about you and all kinds of other information. Now, this is just one of many companies that have been investing in the ICT realm. But when it comes to healthy aging, where it gets really, really exciting is in the biotech side. And in the last year, we've actually seen some advances that have had approvals from regulatory authorities. So one example is from Johnson & Johnson. And they were approved by the Japanese regulatory authority to have these smart contacts that are able to deliver antihistamines directly into your eyes through the contact lenses. And it helps people who wear contacts and may have an allergic reaction or itchiness. Another company that has received FDA approval in the United States is MediPrint Ophthalmics, and they're looking to do drug delivery for things like glaucoma, dry eye, and some other medical conditions where you can wear a smart contact in your eyes for up to 7 days and help you with real-world medical conditions. Another company that's looking at the glaucoma area is SensiMed's Triggerfish. And this one, again, is FDA approved already. And it stays in your eye for about a day and it measures intraocular pressure. Here in Australia, at the Queensland University of Technology, they've developed prototypes where they're actually able to use smart contacts with hydrogel as a corneal bandage for someone who might have had a chemical burn or some sort of heat burn in their eye. And there are other companies and universities around the world doing this too. Another really cool example that I like is from the University of New Hampshire in conjunction with other unis around the world, where they've got a prototype, but not a working one yet, where literally you blink to be able to zoom in and out. So if you wear reading glasses, can you imagine just being able to blink and get a better view instead of having to take your glasses on and off every time you want to see something? Wouldn't that be amazing? I think we're probably at least 7, maybe 10 years away before we start to see wide-scale integration of all of these different technologies together. But with so much investment happening, it's something that is looking like it's going to be near-term horizon. Another really exciting technology that some of you have probably heard of is the stem cell revolution. And there are lots of different ways that one can harvest stem cells, but the most popular way right now is to actually use adipose fat through a liposuction technique. So getting the stuff that we might not like around our bodies and using that to develop things like arteries or a bionic ear, and even eventually human organs that are biocompatible with our bodies. So no more taking anti-rejection drugs. In fact, in Israel, there's a scientist who has already designed a couple of years ago a little miniature human heart that is able to beat. It's probably 10 years before that sort of bioprinting, which is 3D printing, but with stem cells, becomes widespread. But imagine what your life would be like if you needed an organ transplant and you didn't have to go on a waiting list, and you're using the materials from your own body to design the organ to fit exactly inside your body, and you don't have to take any kind of anti-rejection drugs. Wouldn't that be amazing? Another technology that is being worked on in research labs all around the world is nanotechnology. And there's really two aspects of it. One is nanobots, teeny weeny little robots, so tiny that you need a microscope to be able to see the robot, that can be injected into your body and do things like fight a blood tumor that has cancer, like a cancer tumor inside your body. And this is a real experiment that's been done by a number of universities, where literally it's got proteins that bind with the protein that causes specific types of tumors, and it starves it of blood so that the cancer tumors will shrink. This is just the beginning of what nanobots will eventually be doing inside of our bodies. Initially, it will be targeted towards specific diseases, but as I look out over the longer term, I can see that we might have nanobots in our body that act as white blood cells on steroids that literally are looking for defects and correcting them before they become problems. Another aspect of nanotechnology is nanomaterial. And one of the scientific papers that I read just a couple of days ago was talking about the use of these nanomaterials and fighting COVID. So if you can imagine that you've got a mask that has these nanomaterials that are able to capture the different variants of the virus at the mask level before they actually penetrate, that's just one tiny example of where nanomaterials could be really useful. The very last technology that I'm going to talk about today is genetic engineering. And that is something that's been worked on for many, many years now. But what's really interesting is that we now have mapped out a lot of the human genome. We don't know everything that every base pair does, but the promise for this is that at some stage, we're going to be able to find the genes that impact specific diseases and turn them off. Probably the first thing that will happen is that we'll do it at the fetus level while a baby is still growing, but eventually we'll be able to do it in humans as they start to develop diseases. Already, there have been investigations with live mice that have a rapid aging disease called progeria, where genetic engineering has been used to turn back the clock to make the mouse younger again. Can you imagine getting older and having the ability to do genetic engineering and start getting younger and pick the point at which you want to stop? Another thing that's just super fascinating, and we're still probably 10 to 20 years or more away from this, is eventually we're going to find the gene that controls aging. And when we do, our lifespans might be hugely, hugely expanded. There are some researchers that believe that once we find this gene, we will live to somewhere between 400 and 800 years old, healthy, young, vibrant, and having a productive life. Wow, what a difference that's going to make to the definition of what it means to be aging. 60-something, you're just going to be a kid. It's not until you're 800 that you're even considered an oldster at that stage. So I hope you've enjoyed this little whirlwind tour of where we're going with some cutting edge technologies, and enjoy the rest of the day. I'm going to be here throughout the seminar.
Thank you, Shara, for that very thought-provoking presentation. I'm sure that we'll have some questions regarding that after we hear from our other keynote speakers. Our next keynote speaker is Dr. Jane Barrett, the Secretary General of the International Federation on Aging, an international NGO with general consultative status at the United Nations and its agencies, including the World Health Organization. Her leadership drives the agenda for the world's population aging, with IFA strategy and portfolios being viewed through the lens of the action areas of the UN Decade of Healthy Aging. Among Jane's many current positions, she is a member of Vision Academy, a director of Baycrest Health Sciences, and chair of Education Advisory Committee, associate scientist at the Sinai Health System, a member of Global Committee DR Barometer Program, member of the International Council for Adult Immunisation and Task Force, and CSO representative at the WHO COVAX Pillar Vaccine Strategy, a member of the European Interdisciplinary Council on Aging Assembly. Jane's coming to us today from Toronto, Canada, where it's 9:48 p.m. and 7 degrees. So thank you very much, Jane, for actually joining us today.
And thank you very much, Mark. I'm just going to, all right, here I am. Can everybody see my screen, Mark? Okay, super. Good morning and good afternoon to fellow Australians. And thank you very much for the opportunity of me being part of this important event today. Before I start, I just want to acknowledge the many hundreds of millions of people that have been caught in the midst of the COVID pandemic. I understand, and I've just got my stats, I had them here, but we believe that there's more than 5 million people that have died from the coronavirus around the world. And I know that many of my fellow Australians, are experiencing, lockdowns and shutdowns and the urgency for vaccination. So let me tell you that, the light of the tunnel is close to you. So, stay with it. So Mark, you've asked me to talk about our future health, and I do that in the context of the International Federation on Aging. And in this brief time, I'm going to just walk us through some of these areas: introduction, framework, narrative, and the pillars of action. The International Federation of Aging is a membership-based organisation of government, non-government, academic, industry and older people, and we drive the agenda of the world's ageing population. And we do that by being a global point of connection that brings experts together. But we talk about bringing unlike experts together, because now is not the time to sit in our own territory. We need to engage with across sectors and across disciplines. And I was fascinated with some of the future thoughts from Shara that I hope we get to discuss. it is important that with all policies and NGOs such as COTA Queensland and how do we influence these policies, we use reference documents. And these are some of the intergovernmental documents that are available. Mark has mentioned a couple of them. You know, there is the Madrid International Plan of Action on Ageing, the Immunisation Agenda 2030, the UN Decade of Healthy Ageing, the UN Sustainable Development Goals. And these all provide an important reference base to helping to influence and shape policy and the future of policy in Australia. You know, the conceptual framework that the IFA uses in our thinking about, you know, the issues that are impacting current and future generations of older people start with the general work program of the World Health Organization, you know, where we're talking about humanitarian emergencies, we're talking about universal health care, you know, we're talking about, you know, the groundbreaking work of Dr. John Beard, who's an Australian, you know, in the publication of the first evidence-based report on ageing and health. And most recently this year, you know, the first report, the Global Report on Ageism and the UN Decade of Healthy Ageing. But what we see here is we as civil society need to make the links. We need to connect the dots amongst these reference documents. You know, we cannot talk about housing in Australia without talking about the social determinants of health. We cannot talk about rates of vision conditions without talking about access to screening and cost of reimbursement for glasses. You know, and we can't talk about that without talking about function. And I was very impressed with Mark's opening comments talking about function. The way that we look at policy is that, you know, we really need to build bridges across knowledge, sectors and disciplines. So when we're talking about improving the uptake rates of adult vaccination, for example, we know people with diabetes in Australia, you know, are more at risk of serious implications of infectious diseases. So how do we reach across to the diabetes organisations in Australia? How do we reach out to the ophthalmologist to help them understand there's a link between ophthalmology, diabetes, vaccination and civil society? Because what we should be doing is really helping make those connections across the disciplines and sectors. You know, ageing issues are seen for the next decade in the world of IFA through 4 action areas and 4 areas that enable us to unpack these areas. Primary integrated care, you know, this is the portal, you know, for many older people to seek guidance about medical conditions. Long-term care, and Australia has just completed the Royal Commission, but that is just the beginning of unpacking a new generation, a new leadership in services for older people. Age-friendly environments I see as a huge umbrella, you know, that government signs on to, you know, to develop policies where the frame of reference is health across generations with a particular focus on older people. And at the heart of all of what we should be doing is combating ageism, personal, interpersonal, systemic ageism. And how do we do that? Through the enablers of voice and engagement. And that's what we're doing here today. We're voicing concerns and engaging across the sectors, leadership and capacity building, COTA Queensland leading in understanding policies for the future. And in doing so, you know, having this webinar in Parliament House and having Minister part of this series of webinars, connecting stakeholders and also strengthening research and data and innovation. And we know, of course, that we need to call for action to gather data that's disaggregated by age. The elements of the foundational narrative, you know, are known by many, but just to remind ourselves, older people are not a homogeneous population. So let us not choose to see them like that. You know, when Mark was talking about function and healthy ageing, let me remind you the definition from World Health Organization. It is about a process, you know, to enable and improve functional ability in the context of an environment. And so talking about healthy aging, it's the person, the intrinsic capacity of that person, the decisions that we make, the familial tendencies, the genetic inheritances, but also the environment that enables us to do what we have reason to value or not. The public health framework of healthy aging is part of one of those frameworks through which we view our work. You know, the three trajectories that are often seen in older people, the trajectory where, you know, they are functional towards the end of their life. But then there are that cohort of people that will require some services into their home and into premature admission to long-term care or reasonable admission to long-term care. But then you have those people where there is a fast trajectory and declining function. You know, the work of healthy aging, you know, the strategies, the interventions, whether it be for vision health, for diabetes, age-friendly cities, looking at long-term care, you know, each and one of themselves are interventions to improve and maintain function. You know, the way that we also look at this is knowing the challenges of older people in Queensland is the first, but it's the execution of steps of action, monitoring, and then feeding back and renewing those policies that are critical. We know some of the barriers to access, screening, management, treatment, and some of them are played out here. One of the key areas is poor public health awareness, but I'm sure evidence to action means that we reach out across to stakeholders. There are three pillars of action in our work: prevention, access, and equity. And when we're looking at prevention, it is really the prioritisation of education and empowerment. And if we think of that through the lens of ageism, one of the action areas, you know, we can see, you know, in triaging older people, you know, in certain high clinical situations, you know, we can see ramping of ambulances and who is triaged. But we can also see the importance of education around vision health, getting your eyes tested, bone health. So, you know, I think going forward, you know, we need to see the issues of health in the context of function and healthy aging. The second one is about access, you know, removing the barriers. Barriers can be physical, they can be social, they can also be economical. And so for COTA Queensland to examine their portfolios through the lens of prevention, access, equity, it also speaks to the resilience and the remarkable nature of the ordinary being extraordinary in Australian life. And finally, equity. You know, at the heart of inequity is the need to address the social determinants of health. And finally, I'll finish on that we have a collective responsibility to end immunisation inequity. And we have seen this firsthand in this pandemic, when the poorest of the poor have paid the highest price. And so awareness of vaccination, you know, where are the sources of information? The information needs to be nurtured and targeted to high-risk populations. Also, we need to not assume that everybody has the same level of health literacy. And so Australia, amongst other high-income countries, do not pay enough attention to the nuance of language, public health messages and campaigns. We also need to understand and unpack who are the trusted sources. And COTA Queensland is a trusted source of evidence and information for their members, but also the broader community. And of course, vaccine pathways, you know, who is qualified to vaccinate and through what pathway? Can you go to the pharmacist to actually get all of your vaccines, or can only a certain part of the population? So I use vaccine as an example of how inequity exists because it's front and centre in our minds today. And the future of healthy aging really is a civil society alliance. And IFA is one of the leaders in the development of a civil society alliance, and we welcome COTA Queensland and organisations across Australia to join with us because, you know, with a common voice, a consensus of purpose, then we can truly give power to the voices with and of older persons at a national level, but also globally. And finally, I'd like to remind everybody on this webinar today the importance of the Decade Digital Platform. Please sign up, please join, share knowledge, share good practice, ask questions. You know, the voices and engagement are you at this webinar and those that you connect to. And of course, currently there is this social media campaign to combat ageism that started on the International Day of Older Persons and finishes on the World Day of Children on the 20th November. So be part of that campaign. And of course, our global conference is coming up in a couple of weeks in November, so you can join that. And my final comment comes from the United Nations Secretary General Antonio Guterres when he said, in a world tested to the limit, we, that's myself, you, and everybody that you're connected with, we must wake up, change course, and unite. Thank you very much for the opportunity, COTA Queensland and Mark, to be with you this evening. I look forward to continuing to be part of this conversation. Thank you.
Thanks, Jane. Just working through technology. It's always good to hear from you. And as you mentioned at the end, your 15th Global Conference on Aging, Rights Matters, is only in a couple of weeks' time, the 9th to the 12th of November. It's an in-person and virtual conference this time around because of COVID, and it represents a critical point of connection for all those fighting for the rights of older people in a time when their value may be in question against the backdrop of the brutal nature and consequences of the global COVID-19 pandemic. Before we go to Minister Crawford, we'd like to hear from some older Queenslanders about what healthy ageing means to them. So we've just got a small video.
There's 6 doctors anywhere and no one can deny it. Sunshine, water, rest, air, exercise and diet. I live on the Gold Coast, so I've got a couple of those things in abundance. I'm well into my 70s now, but I still play tennis. I walk a minimum of 5Ks a day, try to, and I do aqua aerobics. Being healthy and fit isn't a fad or a trend. Instead, it's a lifestyle, and health is not valued till sickness comes, is it, unfortunately? As soon as you feel too old to do a thing, do it. It's important to have a twinkle in your wrinkle. I have to say, these are the best years of my life. I'm 73 and I'm healthier than I've ever been, and I'm just taking one day at a time. If I'm healthy and happy, that's all I want.
To me, is something we need to look forward to. We really need to change our attitude towards aging, and it can be such an adventure. It can be a wonderful second half of life. I want to be able to keep moving. I want to keep my mobility, and I want to keep doing my yoga. And as time goes by, I'm loving it more and more. And if it stays like this, I'm going to enjoy the aging process.
We're all aging. That's one thing that's certain. But I feel pretty good about it.
Our final keynote speaker is the Honourable Craig Crawford MP, Minister for Seniors, Disability Services and Aboriginal and Torres Strait Islander Partnerships and the member for Barrett River. As Minister, his focus is on improving the social and economic wellbeing of Queensland seniors, people with disabilities and Aboriginal and Torres Strait Islander Queenslanders to enable them to strive. Our Minister will talk about what Queensland's doing in the decade of healthy ageing.
Thanks very much, Mark. Can I begin by respectfully acknowledging the traditional owners and the custodians of the land here in Brisbane at Parliament House, where this event is taking place. Can I acknowledge elders past, present and emerging? And can I also acknowledge the more than 60,000 years of healthcare, of law, of education, and very importantly, the profound Aboriginal and Torres Strait Islander feel for elders as custodians of information, of knowledge, of custom, and of leadership. Can I acknowledge Mark and the team at COTA Queensland? Can I thank Jane and Shara for the presentations, very interesting presentations that I just sat in on myself, and everyone out there who's connected to us today, whether it is midday or midnight, whether you're in Australia or overseas, welcome to everybody. The first 2 decades of the 21st century have been ones of rapid change, socially, economically, politically, and environmentally. The start of this, the 3rd decade, ushers in opportunities for us to make the necessary adjustments that support important demographic changes occurring in Western societies. It's no secret, our world is aging, and we're seeing ongoing change to the age distribution of Queenslanders. Like most developed countries, advances in health and improvements in our environment means that we're living longer. Let me quantify that. In Queensland in 2018, we had 770,000 people aged 65 years or older. That's just over 15% of the population. This is expected to reach 17.3% by 2026, meaning that at least 1 million older people will be calling Queensland home in just 5 short years. And listening to Shara's presentation earlier about potentially growing to 400 or 800 years older means that certainly as a government, we would have to make some significant changes to the countryside around us and how we do business. But for now, we haven't got that technology, so we'll work with the numbers we have. Thanks, Shara. The impacts of population ageing will not be experienced in a uniform manner across Queensland, with regions projected to experience different rates of population growth. Across Queensland, the Metro North, Metro South, Gold Coast and Sunshine Coast Hospital and Health Service catchments are expected to experience the greatest absolute growth in older persons, with these areas expected to be home to more than 840,000 older Queenslanders by 2036. In West Moreton, Torres and Cape and Central Queensland catchments are projected to experience the greatest relative growth. And it's important that the diversity of older people is acknowledged and considered as part of the work that we do as a government. The needs of people living in the Cape are very different to those that are living in Coolangatta. And it's important that the work that we do is adopted by individuals, by communities in a way that's culturally appropriate and scalable. We know that older Queenslanders are sophisticated advocates. We know I'll say that again. We know what they want and what they want to do with their lives. We want to encourage and support older people to have active and healthy lifestyles through enhanced knowledge and skills to create the environments that support healthy choices and provide a diversity of opportunities for connection and for community. I want to take the opportunity to commend older Queenslanders on their efforts to get vaccinated against COVID-19. As of about a week ago, from the 17th of October, 94% of people aged 70 and over have had at least 1 dose of a COVID vaccine, and 81.5% are fully vaccinated. This compares well to the general population aged 16 and over, with more than 72% of people with at least 1 dose and 56.9% fully vaccinated. Those vaccination rates are truly commendable and confirms my point earlier about older Queenslanders knowing what they want. With Queensland opening up on the 17th of December this year, if you are in the 6% of people aged over 70 who haven't been vaccinated, I encourage you to take action. Or if it's people that you know, if it's family, friends, neighbours, to have those conversations. Generally, it's about complacency or it's about hesitancy, and it's important to work out which one of those 2 areas that it is. But make the call today, whether it's GPs, pharmacies, vaccination centres. There's a hotline, which is 134268 that you can ring. Or if you use the Queensland Government check-in app on your phone, down the bottom of that, there is actually a link where you can click on it and it will bring up all the different options that you have. but it's important that when Queensland opens up, we want the health and well-being of older Queenslanders to be very much protected. And the other point to make about vaccinations is that there's an age group that we need your help with to get them to roll up their sleeves. And that's particularly the 16 to 39-year-olds, but even within that, the 20 to 30-year-olds. Many of those will be your children, your grandchildren, and so, in some cases, great-grandchildren in that age bracket. And I encourage you to check in with them and help to highlight to them the importance of getting vaccinated. This is a real critical area for Queensland right now in those particular age brackets. So if you can help us in respect to that age bracket, that would be much appreciated. It's also important that we look beyond the health sector to ensure that our government's supporting initiatives that facilitate independence and active participation for seniors. That includes strategies to engage with and use the skills of Queensland seniors after they retire, and strategies that enable older people to spend as much time as possible in their own homes, connected to family and friends. Our last strategic direction statement, which was called Queensland, an age-friendly community, was released in 2016. It provides a framework for action to support an age-friendly community where the contributions of seniors are valued and older people feel respected and connected to their communities. For example, the Queensland Government is supporting initiatives that challenge how we think and feel about ageing. The Bold short film, some of you may have seen those a couple of weeks ago, was launched on the 1st of October to mark the beginning of the 2021 Seniors Month and the International Day of the Older Person. Challenge stereotypes that create barriers by presenting older people, older Queenslanders, in diverse and active roles in workplaces, communities and family life. And I encourage everyone to track those Bold films down. You can get them online. They are actually quite inspiring to watch. I'd encourage anyone in the community to reflect and discuss how these films challenge stereotypical perceptions of ageing. These inspirational experiences will prompt ideas for strategies to improve community participation by seniors. We're also investing in initiatives that encourage seniors to engage with their communities, from morning teas and art classes to Tai Chi and fitness classes. We fund the Seniors Inquiry Line, an information, advice and referral service to keep seniors connected with their community. And to safeguard those older people across Queensland, we fund the Elder Abuse Helpline and seniors legal and support services. And we also recognise the cost of living pressures are a significant issue for many seniors, which is why we invest more than $423 million a year in cards, concessions and rebates to assist seniors and other Queenslanders on low income to cut costs on electricity, utilities and rates bills, as well as transport and some health costs. But we recognise that there's more that needs to be done. We need to support healthy ageing and take steps now to prevent chronic conditions impacting people as they age. We need to foster inclusive and flexible workplaces that celebrate the contributions and expertise of older people. And most importantly, we need to work together to challenge negative stereotypes about ageing. Instead of costs and deficits, we need to work towards creating a society that embraces older, healthier, happier, and more productive populations and the important contributions they make to our society as a whole. We owe it to our future selves. That's why we're consulting seniors right now about the Queensland Government's next strategy to support Queenslanders as they age. Right now, we're listening to older Queenslanders' views about what they want to see in the next strategy as part of our successful Seniors Expos. We've held expos so far this year on Bribie Island and in Rockhampton and Harvey Bay, and we also met with seniors in Longreach. The expos provide seniors with important information about things like the COVID vaccine rollout, safety tips from Queensland Police, and advice about the seniors cards, concessions and rebates that can help reduce cost of living. There are more expos to come in November, and we'll continue them through next year as well. The expos provide the opportunity for us to listen to seniors about what's important to them. And we're starting a more formal consultation on the issues that matter to older Queenslanders by reaching out to organisations, to service providers and seniors to gather thoughts and feedback on what our next steps need to be to make Queensland a more age-friendly community. So I implore on everyone, if you get an opportunity to provide the input to government through the various different means, please take it, because we only know what we know, and we want to be able to make sure that we can inform future direction by government based on the most important input, which of course is your input. I encourage you all to help us shape tomorrow's age-friendly Queensland and age-friendly communities. Thank you very much.
Thank you, Minister. We do have some time for questions, and we've got a comment from our chair, Peter Howes, that following Shara's presentation, some really big ethical issues and social challenges to work our way through. I might pass over to Jane just to comment about her response to Shara's presentation.
So you're asking me, Mark?
Yes, Jane.
Oh, look, huge ethical issues. However, I just want to go back and just pick up on what the Minister talked about age-friendly, you know, and about the resilience and asking seniors in Queensland their views, which is, I think, is fundamental to the development of good policy. And I think that, you know, when we come to the ethical challenges, you know, that Shara actually started to position in our purview, you know, we've got to go to the community and, you know, and seek their perspectives around some of these technologies and the future challenges. At the heart of what the Minister was talking about is how do we help to maintain and improve the function of, you know, the population of Queensland. That's one of the key messages I took away from the Minister, and the call for Queenslanders to inform policy. You know, the key message for me from Shara is the future is here. It's not tomorrow, it's not next week, it's here. And so I look at technology as an enabler rather than a barrier to our future. I'm not so convinced about the 400 years, because I think our healthcare system is going to require a bit more infrastructure to accommodate that. But I think, you know, one step at a time, Mark.
Thanks, Jane. If you want to ask a question, just use the Q&A function in the Zoom meeting. Just seeing if there's any other questions that are coming through at this stage. Hopefully the sound quality has improved after that video. But Minister, you mentioned that you're holding a number of expos. I think the next one's in Maryborough on the 4th of November.
Yeah, Caloundra is our next one, and look, COVID has certainly been difficult to work through, because we've had to cancel a number of expos because sometimes timing got in our way, where we would have a Brisbane lockdown or something like that occur, or if it wasn't here, it was somewhere else. But we plan to continue more of them. There are significant pockets of Queensland that we've identified looking at where a lot of seniors are, and they're a no-brainer. That's why we've obviously already been to places like Hervey Bay and Bribie Island. We know there's a lot of seniors on the Sunshine Coast. We know there's a lot of seniors at places like Caloundra and Maryborough, but also down on the Gold Coast as well. And we're not going to be doing forums just in those places, but it's, you know, we're trying to reach out and actually have touch points with as many older Queenslanders as we can. Like I said in my speech, all of our previous government policy has really been set about what government thinks seniors want and seniors need. But we need to, we actually need to quantify that. So, for example, we might assume that everyone wants discounts on their electricity bill, and I'm sure everyone does. So do I. Don't worry. But is that, is there something else that we're missing from a perspective of what government supplies? So it's not just the concessions, it's what are the other things that government does through all of our different departments. Is it policing? Is it emergency services? Is it health? Is it somewhere else? Is there something that we're missing? And trying to capture what the future looks like. I think it's a good point. The future is here. And what does that mean, and how do we incorporate that into government policy?
So, Minister, could I ask a question of you? And that is that one of the big challenges is reaching those seniors who are marginalised, isolated, those people are hard to reach. And sometimes, quite often, they're the people that we really need to hear from, because, you know, so how is your government going about sort of reaching out to those population groups, you know, Indigenous, you know, as well as migrants to this country? Could you comment on that?
Yeah, thanks, Jane. And look, it's a really good point. One of the first things we're doing is, you know, government doesn't have, we don't have the ability to knock on every single door, or sometimes we don't even hold the information completely as to who is where. The first thing we're doing is using our partners, so organisations like COTA Queensland and others, for looking for any organisations that might have that penetration into communities, whether it's local governments, whether it's just local groups and organisations who have membership. But there will always be those people that are not connected. And we are actively trying to reach them as much as we can, but you know, we won't be able to get to everybody. But we want to make sure that by the time we get to the end of this, in probably around about a year or so, that we will have had significant feedback from all across Queensland, not just the southeast corner, not just the big regional areas like Townsville and Cairns, but also, as you mentioned, into Indigenous communities, remote communities, communities out in Western Queensland, to get an understanding. So at the moment, we're moving through using peak bodies to try and penetrate in. But we are open to all new ideas. It's why we're doing things like this event today, is to get that word out. So we'll keep pursuing it. But if anyone's got contacts, if anyone is part of organisations out there that has, you know, a good membership of older Queenslanders, feel free to contact Mark and the team at COTA Queensland, and we can make sure that we hook in and circle around yourselves and get the information from yourselves.
Thanks, Minister. And Anne Matson has made a similar point to the one that Jane was just mentioning, and through the Q&A is saying that I'm always interested to hear the views around how we recognise and engage with a full range as possible. So obviously through your portfolio, Aboriginal and Torres Strait Islander partnerships, the First Nations people are a very important part, and your department has good mechanisms to do that. But there's also LGBTIQ and the very, well, the multiple numbers of people from CALD backgrounds as well.
I might just jump in there just quickly, Mark. So there's one thing that we're looking at the moment, which hopefully will roll out fairly soon, but that is we worked out that with the concession card system, that as government sends out the renewals and applications and those sorts of things, that we're going to try and include into those mail outs questionnaires that feed into exactly what we're talking about. So if you receive something from the government in the mail, if it is around the card renewal or those sorts of things, if there's a questionnaire in there, that's what I'm trying to get right. So that questionnaire will come back to me. So if you see questionnaires, please don't just chuck it in the bin. It's actually vitally important that's one option for you to have your say.
Thanks, Minister. And that really gets to those people who are not tech savvy. We did last week, in fact, something with NBN Co around how just advanced some older people are, but we also recognise that it's important that we don't leave anybody behind, and there are some people in Queensland that just cannot, for a whole lot of reasons, use technology. We do have one comment, and it might be the final comment before we wrap up, but Shara.
Hi, I wanted to just talk for a moment again about emerging technologies and access to these new cutting edge healthcare techniques for all aging people. And Minister, this is something that I think certainly would fit into your portfolio, and COTA has a huge role to play as well. And that is for people, irrespective of where they live or what their economic circumstances may be, to have access to the latest in cutting edge technologies. And it may be things like stem cells, which are a real technology now that can be used to grow arteries, veins, bionic ears. These are things that are not science fiction. These are science today, but under today's Medicare regime and in many cases private insurance, these kinds of cutting edge technologies are not available to people from an insurance perspective, and they are extremely expensive to take advantage of, which means that people who are well off have the ability to take advantage of these technologies to greatly enhance their healthcare. But many, many people will not have that access, and that's going to continue to be a problem as we go out further and further into the decade, and some of these other technologies that I spoke of start to become mainstream. We really do not want to have a digital divide in our older population between those who have access to funds and those who are economically disadvantaged.
If I can respond to that, I totally agree, and I think it's an area where governments sometimes have to catch up with where technology is going. That's state governments, Commonwealth governments, and the like. I guess the way I would respond is saying that sometimes I think the argument that government runs inside itself about how we invest in different things can sometimes be a bit skewed. And if you use the example of somebody that has a medical procedure like one of the ones that you mentioned, that puts that person back into the workforce for another 5 or 10 years, government actually does very well out of that, and government actually recoups taxes and all sorts of things as that person spends money. So sometimes I think the arguments at a government level are not being ran properly on the economics of the advantages of maybe spending a couple of $1,000s up front to have a procedure. But what that actually means at the back end, if you were an accountant and sat down and worked it out, you would work it out based on bang for buck and what the government gets in return. And I think that argument hasn't been ran that successfully. I think with some of the policies like this, governments are still playing catch up, and we've seen that with some legislation that's had to go through different levels of government over the last few years to try and catch up to things like Uber and rideshare and different things like that. It was already running out there on the streets, and governments were making a decision about whether they were going to legalise it or not. Meanwhile, millions of people were catching an Uber that very day. So sometimes we can be a bit behind the 8 ball when it comes to that.
Thanks, Minister. And Jane's made the point that a great initiative to send the survey out to seniors card holders, but how are you going to address people who English may not be their first language, or in fact, they may not be able to respond if the survey isn't translated?
Yeah, look, a good point. And, it's an area that we haven't tapped into properly yet, but we are having those conversations. We have very vibrant multicultural societies here in Queensland. We are fortunate in that there are very good organisations that wrap around them, and we are in conversation with them about how we can make sure that communication can go out, whether it's a language or whether it's through some of the other organisations. But that work is currently happening.
Thank you again. And I'd just like to take this opportunity to thank all of our speakers, Minister Crawford, Dr. Jane Barrett from IFA, and Shara Evans. Thank you for a stimulating discussion. As has been said, to foster healthy ageing, we need to work together. As the Seniors Peak organisation, COTA Queensland certainly recognises the potential of older people as a powerful base for sustainable development. Older people must be central to and fully engaged in this collaboration, just as the Minister has indicated. More than ever, we must listen to their voices, their suggestions, their ideas to build a more inclusive and age-friendly society. I'd also like to thank Liz Buchanan, who has produced this webinar, which we hope will be the first in a series of thought-provoking webinars to facilitate positive outcomes for Queenslanders as we age. Thank you very much, and wherever you are, have a safe journey forward. And Jane, best of luck for the upcoming International Federation on Aging's Global Conference.
Thanks, Mark, and very impressive session this evening. So thank you very much.
Thank you.